Hello and welcome to The Explainer. Today we are diving into something that drives millions of people crazy, that persistently watery eye. You know what I'm talking about. It's more than just an annoyance, it's a genuine medical mystery. And right in the middle of it all is this one controversial, high-tech test that seems to promise a perfect fix, but as we'll see, it might be deeply flawed. Let's get into it.
You know the feeling, right? You're not crying, you're not sick, there's no dust in your eye, but the tears just won't stop. It is so frustratingly common, and for so many people, the cause is a total mystery, even to their own doctors. And this is exactly where our story kicks off.
Now, in the medical world, this mysterious tearing has a name: functional epiphora. So what does that really mean? Well, basically it means your watery eye symptoms are very real, but when a doctor does a standard check, like flushing your tear ducts, everything seems to be working just fine. The system looks totally clear.
And that creates this huge challenge. Think about it like this. Your doctor is looking at a plumbing system that on paper looks perfect. The pipes aren't obviously clogged or blocked, and yet the sink, your eye, just keeps overflowing with tears. So how on earth do you fix a problem that you can't even really see?
Well, one potential answer comes from the world of nuclear medicine, with a test that has a bit of a mouthful of a name: Dacryoscintigraphy. Let's just call it DSG for short. It was actually first introduced way back in 1972, and the whole idea was to see past the basic structure of the eye and look at how the drainage system is actually functioning.
The procedure itself sounds way more intense than it is. It's actually surprisingly simple and totally non-invasive. First, a tiny, safe, radioactive tracer about the size of a single teardrop is placed in your eye. Then, you just sit comfortably in front of a special scanner called a gamma camera. And this camera just takes pictures over time, tracking exactly where that tracer goes and, crucially, how fast it's moving through your tear ducts.
And this really gets to the heart of what makes DSG so different from other tests. See, a lot of other tests are like an X-ray or a blueprint. They show you the physical structure, the anatomy of your tear ducts. But DSG is different. It shows you the function, the physiology. So it's not just about asking, are the pipes shaped correctly? It's asking, how well is the plumbing actually working? Is it draining effectively?
And this focus on function is where the promise of DSG gets really exciting. A 2023 study by Bernier and his colleagues, they didn't just want to use DSG to find a problem. They wanted to use it to create a super precise roadmap for surgery.
Their whole approach was just incredibly logical. The DSG test could pinpoint exactly where the functional slowdown was happening. So if the test showed a pre-sac delay, meaning before the tears even got to the main drainage sac, the surgeons could target very subtle issues, like a slightly loose eyelid. But if the delay was post-sac, after the main sac, then they'd perform a more standard bypass surgery. The key here is that the surgery was perfectly tailored to the problem the scan found.
And the results? They were absolutely remarkable. The group with that post-sac delay saw a success rate of nearly 80%, which is fantastic, by the way. But look at this. The pre-sac group, the patients who got that super targeted surgery based on the DSG finding, a 100% success rate. Let that sink in. Every single patient's tearing problem was resolved or dramatically improved.
100%! I mean, that sounds like a miracle cure, right? Which brings us to a really important question. If this test is so amazingly effective, why isn't it the standard of care? Why isn't every ophthalmologist using this for their patients? Well, it turns out there is a completely different side to this story.
And here is where the whole story just takes a very sharp turn. Because on the other side of this debate is a really comprehensive review from Tawfiq and colleagues, also published this year. And it paints a very, very different picture, basically asking if DSG is even a reliable tool at all.
And these authors, they do not mince words. They describe DSG as an investigation that has very little value, and they argue that interpreting the results is often more art than science. I mean, that is a direct shot at the idea of DSG being some kind of precise, objective guide.
And this is probably the single most damning piece of evidence from their entire review. A big meta-analysis found that the specificity of DSG can be as low as 25%. Now, specificity is a really critical measure. It's how well a test correctly identifies people who are healthy.
and a score of 25% is, well, to put it mildly, it's abysmal.
So what does 25% specificity actually mean for you, the patient? It means the test has a massive false positive rate. The data suggests that a DSG scan could flag a problem in up to 75%. That's 3 out of every 4 people who have perfectly normal, totally asymptomatic tear drainage. This doesn't just raise a few questions, it basically challenges the entire foundation of its diagnostic value.
And the criticisms don't even stop there. The review points out that DSG has poor anatomical resolution, which means it isn't great at showing fine details. There's no standardized way to perform or interpret the test from one clinic to the next. Its findings often don't even match up with a patient's actual symptoms, and in a lot of studies it has completely failed to predict who will actually get better from surgery.
Okay, so we have this fascinating conflict, right? One study shows DSG guiding surgeons to 100% success, while a major review basically calls it unreliable and almost useless. So what's the truth? Well, like so many things in medicine, the real answer seems to be somewhere in the middle. The consensus really seems to be this. As a general screening tool for every single person who walks in with a watery eye, DSG is probably not the answer. That high false positive rate just makes it too unreliable for broad, everyday use. However, for very specific, very complex cases, in the hands of a real specialist, it may still be a pretty valuable tool.
So where does that leave us? Well, a few places. First, just like that Bernier study showed, it could be incredibly useful for guiding surgery in those really tricky Presac cases. Second, another study found it's actually effective for figuring out why a patient still has tearing even after a supposedly successful surgery. And finally, even its harshest critics, like Taufik's team, admit it might have a role when a doctor has done a full exam and is still left just scratching their head.
So, we come all the way back to our central question. Is Dacryoscintigraphy a flawed tool, or is it a focused solution? And the answer, it seems, is, well, it's both. It really all depends on how and on whom it's being used.
Ultimately, the whole story of DSG reveals a much bigger truth about medicine. The shiniest, most high-tech tool isn't always a magic wand. Sometimes its greatest value isn't in giving us a simple yes or no answer, but in offering a single focused clue that helps an expert solve the most difficult puzzles. Thanks for joining us on The Explainer.